Placing a patient on a backboard. Here, the lead rescuer, holding manual cervical spinal immobilization, is in charge of all rescue operations and movement of the patient. 3 other rescuers come in and are in charge of moving the body of the patient as well as placing the backboard in the right location. The 2 rescuers split the upper and the lower body. The rescuer with the backboard visualizes the back to make sure there's no obvious injuries before placing the patient on the backboard. The lead rescuer then directs all movement, lowering the patient back down onto the backboard. Now the patient's going to need to be adjusted on the backboard, so they slide the patient down and then back up in a coordinated fashion. Typically this is done with a 3 count. 1, 2, 3, back up. Next in the video, we're going to see the patient lying face down or prone. Again, the lead rescuer is in charge of all operations or movement of the patient as he's holding manual cervical stabilization. In this particular movement, the patient from the prone position is rolled directly onto the backboard. The back is visualized, the legs get straightened, and all movements are coordinated through the lead rescuer. The more hands on the patient, the better in this situation, as it helps to decrease any abnormal movements while placing the patient on the backboard. The patient's going to be rolled onto the backboard as one solid unit, trying to keep the spine as straight as possible. Again, the patient might need to be adjusted on the backboard at that point. Here we see a different angle of the same situation with the back being visualized, the lead rescuer calling out as to when the patient should be moved, always in charge of all patient movements.